Welcoming a newborn into the world is a joyous occasion filled with wonder and new experiences. It's a time of great excitement and, understandably, a bit of anxiety as well. Every parent wants to ensure they are doing everything right for their new bundle of joy. As you navigate the world of parenthood, remember that even small actions can have a big impact on your baby's development. The little things you do every day can contribute significantly to their overall well-being and growth. One such action is ensuring your baby doesn't consistently favor turning their head to one side. This might seem like a minor detail, but it plays a crucial role in their physical development. This simple routine can prevent potential issues down the line. By being mindful of your baby's head position, you can help them avoid complications that might arise from a constant preference for one side. In the early months, babies spend a significant amount of time lying on their backs. This is essential for safe sleep, reducing the risk of sudden infant death syndrome, SIDS, but it can also lead to a preference for turning their head in one direction. This preference might seem insignificant, but it can have lasting effects on head shape and neck muscle development. Over time, favoring one side can lead to a condition known as positional plagiocephaly or flathead syndrome. Positional plagiocephaly can be concerning for parents, but the good news is that it is often preventable with some simple, proactive steps. Ensuring your baby turns their head in both directions equally can help maintain a well-rounded head shape and promote balanced muscle development. By incorporating a few easy practices into your daily routine, you can help your baby develop strong neck muscles and a well-rounded head shape. Activities like tummy time, gentle neck exercises, and alternating the direction your baby faces while sleeping can make a big difference. These practices encourage your baby to turn their head equally in both directions, promoting symmetrical muscle development and preventing potential complications. It's a simple yet effective way to support your baby's physical growth. Remember, early intervention is key. The sooner you start incorporating these practices, the better the outcomes for your baby's development. Consistency and attentiveness in these early stages can set the foundation for a healthy future. By establishing good habits from day one, you can give your little one the best start in life. Your efforts now will pay off in the long run, ensuring your baby grows up healthy, strong, and happy. Embrace these moments and cherish the journey of parenthood, knowing that every small action contributes to your baby's bright future. Newborns are born with limited head control. This is because their neck muscles are still developing and gaining strength. You'll notice your baby's head is quite wobbly at first, requiring careful support. As your baby grows, their neck muscles strengthen and they gradually gain more control over their head movements. However, in these early stages, babies often develop a preference for turning their head to one side. This preference can stem from various factors, including the position they were in the womb, muscle tightness on one side, or simply a preferred field of vision. While it's natural for babies to have a preferred side, it's crucial to encourage them to turn their head in both directions equally. By doing so, you promote balanced muscle development and prevent potential issues like flat spots on the head or neck muscle tightness. Remember, even gentle encouragement can make a big difference in your baby's development. Two common conditions that can arise from a baby's preference for turning their head to one side are positional plagiocephaly and positional torticollis. While these terms may sound intimidating, they are easily understood and, more importantly, preventable. Positional plagiocephaly, often referred to as flathead syndrome, occurs when a baby consistently lies with their head turned to the same side. This constant pressure on one side of the skull can lead to flattening in that area. Positional torticollis, on the other hand, involves a tightening of the neck muscles on one side, causing the baby's head to tilt to that side while their chin turns to the opposite shoulder. This can happen if the baby spends too much time in a position that shortens the muscles on one side of the neck. Both conditions are typically harmless and easily treatable with early intervention. Simple techniques like repositioning, tummy time, and encouraging head turning can effectively address these issues and promote healthy development. Section 4. Encouraging head turning easy steps for parents. As parents, you play a vital role in encouraging your baby to turn their head in both directions. This is an essential part of their early development and helps ensure they grow up with balanced muscle strength and coordination. The good news is that incorporating these movements into your daily routine is easy and can be done through play and interaction. By making these activities fun and engaging, you not only help your baby develop physically, but also strengthen your bond with them. When your baby is lying on their back, position yourself so you're encouraging them to turn their head towards you. This can be done by lying next to them or sitting beside them, making sure you are within their line of sight. Use toys, sounds, or your voice to capture their attention and entice them to turn their head. Brightly colored toys, gentle rattles, or even your soothing voice can be very effective in drawing their gaze and encouraging movement. During tummy time, which we'll discuss in detail shortly, alternate the side you lay your baby down on the mat. This simple change can make a big difference in helping them develop the ability to turn their head in both directions. This encourages them to turn their head in both directions to see you. Tummy time is not only crucial for head turning, but also for overall upper body strength, which is vital for future milestones like crawling and sitting up. Another effective technique is to alternate the side you hold your baby for feeding and carrying. This ensures that they do not develop a preference for one side, which can lead to imbalances in muscle development. This helps prevent them from favoring one side and promotes balanced muscle development. Remember, consistency is key. Regularly switching sides during feeding and carrying can make a significant impact on your baby's physical development. By incorporating these simple practices into your daily routine, you can help your baby develop strong neck muscles and a well-rounded head shape. These small, consistent efforts will contribute to their overall health and well-being, setting a strong foundation for their future growth and development. Remember, every interaction with your baby is an opportunity to support their development. Enjoy these moments and take pride in the role you play in helping your baby grow strong and healthy. Whether it's through play, feeding, or simply spending time together, your efforts are making a difference. Keep up the great work and cherish these precious early days with your little one. Section 5. Tummy time triumphs, making it fun and beneficial. Tummy time is a crucial aspect of a baby's development, yet many parents are unsure about how to implement it effectively. It's a simple activity that can have profound benefits for your baby's growth and development. Tummy time simply means placing your baby on their stomach for short periods while they are awake and supervised. This can be done on a playmat, a blanket on the floor, or even on your chest. The benefits of tummy time are numerous. It's not just about physical development, it's also about helping your baby explore their world from a different perspective. It strengthens the neck, back, and shoulder muscles, improving head control and preventing flat spots on the back of the head. These muscles are essential for your baby to eventually sit up, crawl, and walk. It also aids in sensory development, spatial awareness, and coordination. As your baby looks around and reaches for toys, they are learning to control their movements and understand their environment. To make tummy time enjoyable for your baby, start with short sessions of a few minutes several times a day, gradually increasing the duration as they get stronger. It's important to be patient and consistent. You can make it a fun and interactive experience by getting down on the floor with your baby, making eye contact, and engaging in playful activities. Sing songs, talk to them, and make funny faces to keep them entertained. Use toys to attract their attention and encourage them to lift their head and look around. Brightly colored toys, rattles, and soft books can be very engaging for your baby. You can also try placing a mirror in front of them, as babies are often fascinated by their reflection. This not only keeps them entertained, but also helps them recognize themselves and develop self-awareness. Remember, tummy time should be a positive experience for both you and your baby. Celebrate their small achievements and be encouraging. If your baby gets fussy, try to soothe them and make the experience as pleasant as possible. With time and practice, tummy time can become a cherished part of your daily routine, fostering a strong bond between you and your baby while supporting their development. Section 6. When to seek professional guidance. While most babies develop head control and symmetry naturally with simple at-home practices, there are times when seeking professional guidance is recommended. If you notice your baby consistently favors one side, has difficulty turning their head in one direction, or develops a noticeable flat spot on their head, consult your pediatrician or a pediatric physical therapist. Early intervention is crucial in addressing any potential issues and ensuring your baby receives appropriate treatment. A pediatric physical therapist can assess your baby's muscle tone, range of motion, and head shape. They can then provide you with personalized exercises and positioning techniques to address any specific concerns. Remember, you are your baby's best advocate. If you have any concerns about their development, don't hesitate to reach out to a healthcare professional.